I start here like this because I'm trying to ground myself with the client. Trying to get you comfortable with me like you've known me for years because I'm about to touch your body. Now you take 3 long deep breaths. Now when clients are face up, they have a tendency to look up or sometimes look at you, which is weird. So what I do, if a client's staring at me, then I'll close my eyes, which signals for them to close theirs. So you're gonna keep your eyes closed. So starting off with a little compression into the effleurage, all the way up to the occiput. I'm not losing contact. To know that you got enough lubricant, there's a slight shine on the skin, and you always want to keep this. So if this isn't there, reapply. Ease the head to one side. Hold with the opposite hand. Effleurage down. Around the shoulder, back up to the ear. And once you get here, your thumb does all of the work. So you go down. It doesn't matter which one you start with, whether you start with going down or you start with going back and forth. Because the traps are at the neck and back, you want to go underneath the scapula like we did before. Slightly pull towards you. Petrissage. Same thing on the other side. Now, if you find yourself not having enough time to do what you want on the neck, the good thing is the neck is going to be there while the person is face down. So this is just me warming up the tissue. I'm going to tuck underneath on both sides. I don't have that much space to work with. So I can't get a whole hand on. My forearm's probably too close to her chin. So I'm gonna knock in to her back and forth. So what I'm gonna do is come here and just work outward and down. Your strokes are gonna depend on how much room you have. So if I have a lot of room and the chest is flat, or there's a longer strip before you get to the breast, or if I'm working with a male and I don't have that issue at all, I can pull down a little bit. But if I'm only have here, I can hold up and just come in. This hand's holding and massaging, well, this one's going down. Both at the same time, just move out towards the shoulder. Hand over hand at the sternum, pull out towards the deltoid. Now each stroke is going in two different directions. One's going this way and one is going this way, kind of like a pizza slice. And that's because your rhomboids is that shape. I'm sorry, not your rhomboids, your pecs. That shape, the rhomboids are in the back. From here, I can go into the arm, or I can go into the other side of the pec. The reason why I'm gonna go straight into the other side of the pec is because if I go into the arm, then I might forget it. That's just my way of thinking. So keep hands on, slide the other hand on, affleurage again. Now with my transition, while one hand is leaving, the other hand goes to where I'm going. Pull down, take the arm from underneath, tuck. So if I'm going to break the arm into sections, we have three: top portion, mid, bottom. Gonna start in the middle. Forearm opens up the hand, so I'm gonna go work top of the forearm, a few effleurages, and everything else I'm doing, I'm gonna just strip the muscles. Going to the inside, turn at her.
I'm sorry, Jason. Something's going on with my phone right now. It keeps stopping the video.
That's fine. Hers is going. Okay, strip inside the forearm. As you can see, if you're looking closely, her fingers are starting to pop up like she's playing the piano. That's how you get the hand to open up. You don't start at the hand, you start in the forearm. Now, if the hand's not opening up at all while working on the forearm, then the biceps can be too tight. So go up to the bicep. Instead of using my arm, just add a little bit more oil. Use my forearm. So I'm getting both biceps and triceps here. And you want to keep your other hand at the wrist to support the joint. Same thing, use your thumb, strip the muscle. Now I'm holding her hand in this arm and I'm using my thumb. What's happened is it's turning into a lever. So as I bring her hand down, my hand's going up. So the fibers in her muscle is starting to crinkle a little bit underneath my hand. So basically me running across the fibers, it's like me strumming a guitar. They're breaking up as I'm going up. So as this comes down and my hand comes up, do you feel that? And I'm not really using any pressure at all. I'm gonna come in. And just open the hand up some more. Starting at the wrist, moving towards the thumb, and up towards the fingers. Tilt the hand back down, and in between each joint, just gonna turn. A few squeezes. About the deltoid, a few circles around here. Relax. Down. Here we go. 5 minutes. I'm going to do the same thing on the other side, but it's going to change the position that I work on the arm. So first, I'm going to move the blanket out of the way and not try to do both at the same time. I'm gonna shift this up over her breast. I'm gonna pull up like the diaper drape and really tuck underneath her back. The reason why is relax yourself. I'm gonna massage her arm like this. This allows better access to the elbow. And inside of her arm. So I'm going down from the top of the pec, working out towards the deltoid, and in. Just lifting, a little petrissage. Then lift the arm up, relax. You can hold it this way. Now the reason why we tucked is so that, relax her, fully covered. This allows you to get deeper into the tricep. If your client has any issues with their elbow, brings the elbow to you, and you can work around it. In this position, you can stretch. Bring the arm up like this. strip both sides at the same time. Now, hands pretty much open. Go back up. Same thing. Turn around each joint. Pull like the fingers. I forgot I originally said 3 minutes, so I'm gonna wrap it up here. Slightly untuck. I'm gonna lift you up a little bit. There you go. Slide down back underneath. Now when you're ending on a body part, always compress at the end just to kind of show that you're finishing up here. And into the legs. I'm gonna diaper drape because I'm gonna move her legs a little bit. The legs, you have a lot of muscles to work with. So if you break it up into 3 sections, you have the vastus medialis, vastus lateralis right here, right? And I have the IT band as well. I'm gonna break this up into 3 different sections. We're gonna work the middle first, the medial side, and then the lateral side. All the way to the toes. Now you guys use your hands a lot. After my effleurage, I'm not using my hands. I'm going straight into using my forearms because I can do this all day without getting tired. And there's going to come a point where you're going to have to do this all day and hopefully not be tired. So instead of, as far as pressure goes, instead of me trying to apply pressure, I'm not that strong. I don't want to do it that way. What I'm going to do is I'm going to stack my joints on top of each other. So my elbow is here, so my shoulder is here. So I'm slightly leaning into that to create the pressure. And all I'm doing is moving my body forward and leaning it backwards. So my forearm is covering this entire muscle. I'm gonna come to the outside, around the knee, same thing. I can do both at the same time. I can come back with my fist. Now to get to the middle of the leg, I'm just gonna pop the knee out and push the foot in. Readjust the draping out of the inside of the leg. Now I'm not gonna use my hands on the inside, I'm gonna use my forearm. So after about midway up the thigh, switch my stance, all forearm. I'm just leaning in. It's comfortable? Now to get to the IT band, I'm going to use this hand. Just immediately rotate the leg and use your forearm. As soon as I come to the top of the knee, kind of like a windshield wiper, except going out, I'm going to do this around the top of the knee. If anyone has any type of knee issues or knee pain, definitely want to work around it. Not necessarily on top of it, but just around. And down to the calf. Squeeze at the feet. When you get to the foot, this is the fun part. You just pop the foot up. You can use the top hand, slightly stretch the foot, and then you're going to strip the muscles going down towards the heel. Go back up. And do I need to do it on the other side? Or you guys get it?
Good.
You good?
I'd appreciate if you do it on this
Okay.
side, please. Thank you. 'Cause I'm
Readjust. Sorry. So if you have more time on the leg, let's say more than 5 minutes, you got 10. You want to do a lot of work over top of the sheet. This is the area up here in the hip that we don't really get to once you're draped. So you're going to use compression.
Can you show on yourself where you're hitting?
Right here,
Gotcha.
top of the hip. Sometimes the more compression you do over the top of the sheet, the more the client relaxes.
Mhm.
So if you have those extra few minutes where you can just do that, it'll be really helpful with them not being as stiff. See, where her leg, I was able to move her leg any way that I want to, but do you remember at the top where I kept telling her to relax her arm? She wasn't relaxed yet. Once you get the client into that zone, then they'll be able to just loosen up a little bit more. So we're gonna pretend I'm wrapping up a massage. Redrape my client completely. We're gonna take a long deep breath to complete our session. Just gonna do some final compressions. Just a few final strokes. Then you remove the bolster. Then proceed to tell your client whatever it is that you need for them to do, and then the session's over.